Hello, everybody. Okay, I want to reiterate what my partner said earlier. There's, according to the U.S. Census Bureau, there's over 45 million people without health care that are uninsured in the United States today. And health insurance premiums are rising at a rate 3.7 times faster than wages. That's according to the Kinzer Family Foundation of Health Research and Education. And also, according to Yes Magazine, around the same number of people that are uninsured are also underinsured. And I would like to say that your average American cannot afford to provide health care to oneself and their family without assistance. Now, I went and found the prices of a couple of medical procedures, and in this country they're very expensive. For instance, if you tear an ACL in your knee, a reconstruction surgery can cost you from $20,000 to $50,000. An MRI can be $1,100 to $2,700, and a simple tonsil surgery can be over $5,000. I got those figures from costhelper.com, which is a website where it tells you how much certain things cost, and that gives a pretty accurate estimation of how much a simple surgery would cost. I mean, and usually if you need to get tonsil surgery or an MRI, it's always unexpected. You don't plan for something like that to happen. And I would also like to claim that the healthcare system in the U.S. is flawed and expensive. According to the same article in Yes Magazine, 18,000 people die annually because they did not have medical coverage. Also, from the book Money Driven Medicine, it says the uninsured receive about 60% as much care as the insured. And according to the Institute of Medicine and their article Care Without Coverage, uninsured car crash victims receive less hospital care and have a 37% higher mortality rate than insured patients. And also from the book Money Driven Medicine, says adults have uninsured adults have a 25% chance, greater chance of dying. Now, the United States has the highest infant and newborn mortality rate when compared to Canada, Japan, Norway, Iceland, Finland, and the Czech Republic. Now, one thing that leads us to believe that the U.S. healthcare system is flawed is the price of it. We spend around 15 to 16% of our GDP, and that's ever increasing. Now, to say if we spend more money, it's usually better, but this is not the case. The cost is rising still, and it says by the year 2017, the money spent on healthcare will be $4.3 trillion, or approximately equal to 20% of the GDP. And this is from the Health Affairs web exclusive. There's also a number of bad policies in place that allow severe inflation and other things to happen in the medical market. For instance, the 2003 Medicare Prescription Drug Improvement and Modernization Act states that the government cannot negotiate prices with prescription drug companies. It's forbidden for the government to do so. And according to the Cost of Healthcare Administration in the United States, only 4% of every dollar is spent on the prevention of public health. All right, and the cost per, according to the New York Times, the cost for healthcare in 2006 was over $6,000 per capita. Now, and people want to know why the healthcare cost is so expensive in the United States. According to the New York Times, also, a couple of erroneous reasons are that the population is aging, and that's driving up healthcare costs, and that we get better healthcare than all of our nations, but neither of those are correct. The New York Times also states that what contributes to the higher costs, that we pay more for the same goods because the prices are inflated. There's significantly high overhead because our complex system has high administration costs. And then I'd like to claim that there are other systems in place worldwide that do work better than the United States healthcare system. As Barrett said earlier, we are the only nation that does not promise universal healthcare as a right of citizenship. The only industrialized nation that does not promise healthcare to the citizen. And the U.S. health system spends a higher domestic product, a higher portion of its domestic product, as stated, and we do not rank first. We rank 23rd in informed mortality, 20th in life expectancy. Hughes all said those earlier. And the U.S. is the most expensive. Since the thing is, we pay 40% more than every other country, but we rank far, far lower than countries that pay much less, and that is because the policies in place are stopping efficiency, for